And thank you for joining us here for 23 ABC News. I'm Keely Van Middendorp.
And I'm Mark Blaine. Adventist Health and the insurance company Anthem Blue Cross are in the middle of contract negotiations for rates when it comes to providing health care to Adventist Health patients. But if an agreement isn't reached, some may have to find a new health care provider.
23 ABC's Brianna Willis explains the significance of these negotiations. Brianna.
Mark Keeley, Adventist Health says it's been a number of years since they've taken this aggressive of a stance with an insurance provider. But they say it's because they want to reach an equitable agreement with Anthem Blue Cross, as Anthem is their second largest commercial payer for their patients.
Anthem's decision to fail to come to an equitable agreement with us is putting the patients in the middle of this contract negotiation.
In the last 5 months, Adventist Health and Anthem have exchanged 14 contract proposals. But President of Adventist Health, Kern County, says for them, none of the proposals from Anthem have matched what they have asked of other local businesses and consumers in the community.
We are simply advocating to be treated equitably in relationship to the rate increases asked of area consumers who have seen their premiums increasing. We simply want to keep Kern County dollars in Kern County.
Walcott says due to COVID, their hospital has had to increase funds for staff, and that's what makes this negotiation even more important.
Our healthcare workers have put their lives on the front lines of making sure that people get through the pandemic. We've had to pay them more to do that, which was fair to them. That's the way the market works. And so we're saying to Anthem that you need to step up and be a part of the solution going forward.
23 ABC reached out to Anthem Blue Cross for a response to the contract negotiations. Michael Bowman, spokesperson for Anthem, says Anthem has contracts with a number of hospitals in Kern County, including Bakersfield Heart Hospital, Bakersfield Memorial Hospital, and Good Samaritan Hospital, among others. They also sent us this statement, reading in part, "We've offered reasonable increases that are in line with what other provider partners receive for the same services, which will help keep healthcare affordable for those we serve. We believe our care providers should be reimbursed fairly, and that has been reflected in our offers during these negotiations. Our hope is to reach an agreement with Adventist prior to the current contract expiring, but if our efforts continue to be rebuked, we will work closely with our members to ensure they have access to quality care from any one of the many care providers in our network. And if they fail to reach an agreement by July 18th, new patients will not be able to be treated at Adventist." But Walcott adds that Adventist Health will continue doing whatever they can to serve their patients.
So first and foremost, on July 18, all care for current patients at Adventist Health will continue. We will not be asking people to leave or adjusting their care. What we are committed to do is always provide the best care for our patients.
According to Anthem Blue Cross, they have a meeting tomorrow with Adventist Health where they hope to reach a resolution. We will continue to follow the negotiations and provide updates as they are made available. In studio, Brianna Willis, 23 ABC News, connecting you.